Welcome to the Connectors podcast, the show that helps you build meaningful connections and transform your life. I'm your host, Quinton Sheriff, and I'm joined by my co-host, Jolyn Showalter. Do you want to reinvent yourself and grow your mindset? Do you want to make valuable connections and community and take your life and work to the next level? Then this podcast is for you. Join us as we explore the world of reinvention and uncover how it can lead to more meaningful connections in our lives.
Welcome to the Connectors podcast. Today on our show, we have Michele Bolton, who is the creator and entrepreneur, CEO of my911.ca. Michele is here to talk to us today about a healthcare technology tool she created called My911. In this episode, you're going to learn what the benefits of My911 are and how Michele created this wonderful tool for people to use that is end user friendly. Anyone can use it. Its purpose is to create a better patient experience when dealing with the healthcare system.
Hello. How's everyone doing today?
Hi, good. How are you, Quinton?
Yeah, good. Thank you. Welcome, Michele.
Thank
Hello,
you.
Michele.
Thank you for having me. I appreciate the invitation.
Yeah, it's awesome. Glad to have you here. And I want to give a little intro for our guest today. Well, not a little intro because she deserves a huge intro. So as an experienced professional, she brings, let me start again. Okay. As an experienced professional and entrepreneur, she brings discipline and focus and a positive attitude to work and team environments. Her background ranges from agriculture and farming and in the corporate business world. She is the founder and CEO of My911, which she started in July of 2018, which is a healthcare technology tool. And I want to let her share her story with you because it is such a wonderful story. And please join me in welcoming our friend, Michele Bolton.
Yeah, this is exciting. Thank you so much. I am honored to be here and to share the story of My911. So the first question is usually, what is My911? Right? People usually say, what is this? So basically, My911 is a service that provides users with a customized wallet card that displays a QR code linked to an online emergency profile that's designed to streamline emergency medical communications through written and smart technology for emergency responders, patients, and healthcare professionals. So the beauty of it is that the end user, the patient, has full control over the information they choose to share on their profile and on their wallet card. And the experiences I've heard of so far are amazing. They absolutely love it. It's reduced the stress, it's reduced the frustration, and it's thrilling to know that this little idea is doing exactly what it's meant to do. From inception to market, I'm thrilled. I'm just thrilled.
Thank you for being here to share your story, Michele. When Michele and I met not that long ago, and when she told me her story, I was just blown away. She entrusted me with this beautiful background of her experiences in the healthcare system and how this came to be. And I'd love if you would, I know you want you to share whatever you feel comfortable with. So please let us know how My911 came to be.
Of course. So when I was in my early 20s, I had my daughter when I was 21, and that experience was difficult in and of itself. And shortly thereafter, I wanted to get pregnant again. And I ended up in emergency surgery with a partial hysterectomy. And a couple of years later, I thought, I'd like to have a child. So I tried again, and I was in emergency surgery again for a full hysterectomy. So they took everything, which was extremely devastating. And after that experience, about a month after I was out of hospital for that, my father passed away from a massive heart attack. So I was 25 and he was 53. I was 53 at the time, and completely devastated our family. It's tragic, it's emotional, it's something that you don't plan for, obviously. And it marks you for sure to lose your parents because they gave you your life, right? So after my dad passed away, then about 3 years after that, I ended up in emergency surgery again with gallbladder attack. And I couldn't even drink water. So it was really frustrating. And so they took out the gallbladder and then got back to life and kept working and kept moving along. And 3 years later, I was working out, doing all the right things that I guess we would normally do. You eat well, you exercise and take care of your body. And I got home one night and I couldn't even climb a flight of stairs. So I was completely wondering, okay, I think I've got bronchitis. There's something going on here, chest cold or whatever. So into the doctor I go, and he said, well, actually, Michele, you have a heart murmur, and I'd like to do a chest x-ray. So I said, okay. So in he goes and does his chest x-ray, and I'm waiting. And about 15 minutes later, he came out and said, well, the three of us feel you may have Hodgkin's disease. And I'm like, well, what's that? I had no idea. And he said, cancer. And I said, excuse me? And he just said, yes. He said, come here, I want to show you something. So he took me in the x-ray room and showed me the x-ray. And I just said, what is that? And he said, that is a tumor. He said, we can't see any organs in your chest. We can't see your heart. We can't see your lungs. We can't see anything because this mass is everywhere. It's completely overtaken your chest cavity. And I just looked at it and I thought, okay, that's why I can't breathe. Clearly, that's why I have a heart murmur. So they sent me home. And when I got home, I had to pick my daughter up from the bus stop and went back to the house and told my husband at the time, I'm not ready to die. Like, this is unbelievable. So my daughter was extremely upset. I asked her to go out on the front porch because I said, I need to talk to your dad for a minute. And she said, okay. And then I just said, I need a drink. Please pour me a shot of something. So he gave me a good double shot of rye and I knocked that back because I was in shock, of course. And I just stood there and said, I'm just not ready to die. And my daughter came flying in, screaming and yelling. She's 9 years old, right? So she's like, you lied to me, and really upset. And I said, okay, we need to have a conversation. So that was in the spring. I can't recall exactly the date, but in July that year, they admitted me to the hospital. They explained that they would have to do open heart surgery. They referred me to a specialist initially, and Dr. Richard Ingulett, who is absolutely amazing. He saved my life, and I will forever be indebted to him. So I'm 30, and obviously, we're always vain. We're always wanting to make sure that we look our best. So he said, well, I'm going to have to do open heart surgery. And I said, oh, okay, that means I'm going to have a big scar, right? And he said, he just said, Michele, that's the least of your worries. And I said, well, what are you talking about? He said, I don't know if I can save you. You need to say goodbye. And that changed everything pretty quickly. So I went home, tried to absorb it, and waited for the surgery. And I had the surgery on the 19th or 20th of July before my birthday. And yeah, I waved goodbye to everybody when they took me to the OR. And I was very surprised to wake up. And when I did, there was obviously a lot of pain, but it was quite a miracle to get through that. And then, and move on with life. We get back to normal. And then a couple of years later, I go into Strathroy emergency and said, I think I've got, I think strep throat or something. I was not feeling well. And he said, oh, have you had any surgeries before? And I'm like, yes. Which, what do you want? The list? So I gave him the list. He's like, Bolton. And he's repeating my last name. And he says, I studied your chart in med school after I explained that I had teratoma. And he's like, yeah, I charted your chart in I studied your chart in med school. I'm like, you're welcome. I didn't know what to say, right? I'm like, I'm going to bring my nephew to this because I'm in shock. So I said, he's like, wow, that was quite a medical chart. And I said, Yes, it was, and not much fun to go through. So
No.
what about my throat? Can we just move on here? So he was really good, and I got some antibiotics and I was fine. But it's devastating to everybody. It's devastating to your family. It changes who you are. It changes how you look at the world, and it puts everything in perspective. There was not a single dollar I could have paid him to save my life. Money wouldn't have mattered. I was in God's hands, and whatever happened was going to happen. But you're never ready to say goodbye, certainly not at 30. So you learn gratitude, you learn what's really important. And I had taken care of myself really well, and for a month before the surgery, the entire farming community was in shock, and they kept saying, oh, Michele wasn't going to make it. There's no way she's going to make it. And Amanda, my daughter, who was 9 at the time, that's all she heard was her mother wasn't going to make it. So when I did get home, I saw any photos that I was in were turned upside down around the house. So I asked, what's going on here? Why are all these photos upside down? And he says, everybody said you weren't going to make it, and she couldn't bear looking at your photo anymore.
Oh, that's heartbreaking.
So I said, well, let's turn all these back up, because I'm going to be around a long time to tell you to clean your room. So she's like, okay. And then off we go, turn all the photos back up. But yeah, it does change how you just look at everything. And I'm just very grateful.
I'm always curious about that. When people say they've been through something really traumatic, that it does. And I'm always so curious of what that feels like, just because I do feel like I hold gratitude each day, but having that very different perspective, I don't have it. So I don't know how much it would change. I'm just fascinating to me.
It's pretty amazing when one day, you're feeling beautiful and great, and you're energetic, you're doing whatever you want. The next day, that's it. It completely changed in a matter of minutes after I got that x-ray. And, nothing prepares you for that. It's just something you can't prepare for, but you end up having to face. And it's tragic, it's difficult, which is ironic that I now have a mobile healthcare technology company, but now the mission is to empower other patients to improve their communications, streamline medical communications, and, build that life raft that literally everybody can get on, to bring them some awareness, peace of mind, and convenience through this service, so they don't have to go through those frustrations, because it is really frustrating having to constantly answer the same questions when the only thing you're worried about is your health. The only thing you're worried about is what's going to happen now, and how do I solve this problem? You're not worried about, this is where I live, this is my phone number, these are my emergency contacts, these are my allergies, these are the medications I'm on, all sorts of questions. I know they have to ask them, and I understand that. From a patient perspective, it's really frustrating. I'm sure from a healthcare professional perspective, this is taking so much time. Like, why do we have to do this? Even from department to department, they're asking the same series of questions. So I've used my card 5 times now, and 3 times during one appointment, and they just look at it and say, what is this, and where did you get it? And I said, you know what? I really appreciate and love you guys, but I'm so tired of your questions. I said, so it's called My 911. It's a new company that I started to do exactly this, to streamline the communication, so that you don't have to waste your time trying to play to play games in these appointments, asking the same questions, so.
Totally. I mean, the times that I've had to go to hospital and do visits, you're always being sent to 2 other departments on 3 other floors or whatever's going on, and it's always new nurses and new specialists, and so I can imagine that it really sort of streamlines things. It makes it a lot easier. But tell us, Michele, how does it actually work? So what is it? How does it work?
So so on the website, my911.ca, people can go and register for their emergency profile. And what that does, that registration gives them their customized wallet card. during the registration. Basically, it pays for that, and then their emergency profile is created. So once they have the confirmation of their purchase, then they set up their emergency profile, and it's basically a wizard that we have created to basically walk them through step by step, to fill out their medications, fill out their conditions, fill out their emergency contacts and phone numbers and things like that. And, they have full control over what they're sharing. If there is something that is too sensitive for someone to share, that's their choice. Leave it out. That's completely their prerogative. And that's the purpose of this, is I want to respect people's privacy. I want to provide a service that gives them the flexibility and the control over their life that we normally don't have control in our health. Like, not always. I mean, even when I was doing everything I thought I could do, I still ended up having to say goodbye. So there are things out of our control. And when it comes to your health, I think during the last few years, I think if nothing else, it brought to light that it's first and foremost in our lives, because it affects every other part of our life. We can't travel, we can't be around other people, we can't do the things we want to do to do what we need to do here, whatever their purpose is, whatever their hobbies, their interests are, how they enjoy their lives. You can't do it without your health. And there is no discrimination around the age of when you could have an unexpected situation like this. It can happen to anybody. Cancer and all these diseases, it doesn't matter how old you are. It doesn't know that. It just chooses you at a certain point in time, and you have to deal with it. So I think having the control over this and the flexibility to update it anywhere they are as their healthcare needs change is a really great feature. I've had many, many people say that to me already, and the members love it. They really appreciate that flexibility. So
yeah, I was seeing some of the testimonials that you posted, I think, on LinkedIn. Yeah. So I love that. That's awesome. And it's nice to see that and hear that already people are experiencing what you've experienced having it. Yeah. And that it just creates a little bit more streamlined process and creates that comfort and security that that all of your information is there and whatever information you specifically want. Now, I'm just curious, because I know I've asked you this before, but I know people probably listening to this will want to know what are any concerns that people would have in terms of, privacy and where their information is stored, that kind of thing.
Yeah, that's a really good question. And that, is first and foremost on my mind with every decision I make, because my card was the first one printed. My information is out there. It was the first out there. So everything is printed and manufactured in Canada. We're very, very lucky to do that. It was important for me, since I am a Canadian, I guess, to create a Canadian service that could utilize as many resources in Canada that I could. But I think having the data stored in Canada was really important for a lot of people. So they just want to make sure that it's protected and it is safeguarded, which it is. And again, the main concern, they get to choose. If there is something that is just too sensitive, that even with all the safeguards I put in place, that they still are a little nervous or might be a little nervous, they don't have to put it on there. But so far I haven't had that issue. So everybody has been, their profile is their choice. It's their information. And I don't own their information. They do, so it is their choice. It's, I'm not forcing anyone to be on this service. It's completely by choice to help other people, help you. So.
Okay. Oh, that's great. So there's a QR code on it, and it can be scanned by either a phone, or how else can it be accessed? This information be accessed?
Yeah. So basically it's like any other QR code that you would find, right? You do scan it with your phone, with a camera on your phone, and it brings up the emergency profile on the front end that is on the preview page. So they get to see what that looks like before it's actually scanned. And in the event that you had lost your card, as an example, then you just log into your dashboard and you deactivate that QR code with a click of a link, and that's it. It's no one can access it. So there's a lot of different safety measures that have been implemented. And, we continue to just build on the options that are available out there to make the service even more dynamic. But I have a wish list for members for sure. They will, can you do this now? And can you do this now? And I'm like, that's so funny. I'm going as fast as I can. But, we never even had this before. Now we have it, and I've got this list of requests.
All these upgrades already.
Yeah, they're added to the wish list. So, and I'm happy to do that. And that's the beauty of it, because I'm nimble, and it's, I can make changes as I get those requests in and put them on the list. So it's awesome.
I like what you're even saying about the your health card number, because someone might be worried that, okay, well, if there's private information like my health card number, people can steal your identity with that, but it doesn't fully display it, correct?
It does not. I've had, 2-3 other members say that they've brought it to either their dentist or their doctor, and the first comment is, wow, this is great. Because it just makes their life so much easier. And it's providing information that is entered when you're in a good state of mind. When you're calm and you're healthy, you're entering information that you need. So you're not carrying bags of medications to the hospital, to a clinic, wherever, to let them know what you're taking. Or they have their own forms that they want you to fill out sometimes. And this kind of changes that game, because a lot of seniors, for example, may not have phones, right? They don't want to fill out the forms, but they have this card that is, they don't need their phone. Anybody can scan it, and it doesn't stay on their phone. There's a security measure there as well. So it will disappear. And so, it's really good. It saves a lot of time. And, if you had a family with a bunch of children, if you had 2, 3, 4, 5 kids, and you wanted the service for your children because they all may have a different medical condition or situation, then you can have an unlimited number of emergency profiles on your dashboard that you control and manage separately and independently. So they're all paid for separately, of course. And there's no contracts and fees for cancellation. There's no problems with that. If you want to pause a subscription, just you pause it. You don't have to worry about, canceling it, and you can reactivate it later if you like. So there's a lot of flexibility.
So around. Convenient. Yeah.
So if your mother-in-law goes into a coma, you just put her on pause.
Well,
it's one way to look at it.
Cracking a bad joke at a serious time.
Okay.
Yeah. But you make a good point. Like, if there's caregivers out there, and they manage quite a few different family members' profiles, and how are they currently managing it? And
right.
I know my first member, this is a great story. She shared with me that, her grandmother carried a binder around her entire life because she had such a rare condition. I can't even pronounce the condition and would never remember it. But so she carried around a binder to help assist with managing it, all of that information. And once she got the My 911 card, she could file the binder away. And her grandmother was thrilled. I had tears in my eyes it was really surprised me. I knew I was just so frustrated and wanted to create a solution that was easy for everybody to use, but I had no idea I would have a physical reaction to a story like that. And it warmed my heart. I immediately started getting tears. I'm like, wow, this is powerful.
Because it's exciting, because you're helping the person whose medical information you're storing. You're helping the medical system as well. You're helping the family of those people. There's all these people that are positively affected by streamlining this information into one spot. Yeah,
exactly. It's connecting. It's the great name of your podcast, The Connectors. It is connecting the healthcare system in a small way. I'm trying to make a contribution to help our healthcare professionals and our EMS people. Even when seniors have rotating personal support workers, they're having to repeat their story over and over and over. And let's say they had the onset of Alzheimer's or dementia. How do you know?
That's very tough. Yeah.
Really giving you the correct information.
Yeah.
And so you have to contact the caregiver, and caregivers, it's got to be exhausting. I haven't been a caregiver before. However, I have heard of other situations, and it's exhausting. And what if they want to go on a trip or leave town and have a vacation away, right? They still have the ability to manage this profile wherever they are.
Wherever they are.
So there's a lot of powerful flexibility that I'm hoping will benefit just so many people at the end of the day.
And
Absolutely.
Something that stuck out for me when we were originally speaking was just the fact that if a family member is distressed, or you're in distress when you're trying to give medical information, because that's possible. Someone could have been injured, or, like you said, Quentin, if someone has dementia or anything like that, like it just takes that away. It just takes away that whole part of like, this is a traumatic, event that's going on, and I don't even have to worry about that information that's being shared right now. I think that's a huge value
it's
add.
Necessary medical information. That's the quicker it gets to the specialist, the quicker they can take action on the situation. Exactly. Absolutely. I was also thinking back in the day when I was a teacher and I was taking students around like to another city or something for the week, or into the jungle for a school camp or whatever, and how useful that would be if you had a student who had some sort of medical needs, and maybe you could say to the parents, look, there is this service, and instead of signing all of these forms and getting all of this paperwork done, you just get this card and it travels with your child, and everyone will know about it. And I think, it would have been very useful, because there were a couple of situations where we actually did need some sort of medical situation, because there's like 110 students, and if those 3 learners had a card on them in a foreign country, how much easier things could go.
Exactly. And that's a great segue into the point of immigration. So when you have new immigrants to a country and they can't speak English, or English is their second language, and they end up in emergency, are they playing charades with the registration desk, trying to show them what's going on? Like, you don't know. And I don't have that experience, obviously, but I can only imagine, as a healthcare professional, the stress of not only the healthcare situation and the pressure they're under these days, with reduced staffing, reduced resources financially, and the burden of being overworked and burnout. This is almost like buying time, right? And how powerful is that? Because that's one of our most precious commodities. So I think having that ability to provide a service that other people can use, who may not speak English, but you can have someone help you enter the information who can speak English. That's one of the changes in dynamics for the service as well, will be translated in different languages so that it will be convenient for people. There's a long wish list of different things.
That was my follow-up question, actually. So if somebody was traveling with it, though, to another country, let's say, so if you were going to go to Italy, on vacation, is that possible that it would translate for them, or would it just still be in English and they'd have to?
In English.
Yeah,
it would still be in English, core business language worldwide, I believe. So I think you do okay. But I think there is a way. Again, I'm not a web developer, but I have a very, very good one. So there probably is a way to be able to allow that translation feature when they're there, so
there'll be a way. And I think it's a super versatile offering. If you could sort of embed that or implement that, it would be amazing.
We're very close to implementing that translation service. So we're currently working on quite a dynamic update. I'm really excited about it. So it's great the way it is now. Don't get me wrong. I love it, and it's been perfect. But there is a wish list that I'm working on. So there's a lot, even more, that's going to be added to it that people, I think, will really appreciate. So, and I'm open to that. If anyone has any questions or wanted something that was, really specific to them added to the service, just let me know, But again, depending on the request, it has to align with compliance, regulations, security, privacy. Those are the pillars and guidelines that I use to drive every decision. It is about keeping the patient's information private and safeguarded at all times. Those are my core values, and I want to build a brand that people recognize, even just through the logo. They recognize this is communication with EMS. This is communication with, the hospitals, the clinics, the pharmacies, the dentists, personal support workers, anybody. As soon as they see that logo, they know what it means. That is the, it's a goal. It's going to take time, I think, but
it's a very worthy goal.
I have a feeling we're going to start seeing this logo everywhere.
Me too.
Yeah.
Me too.
Yeah, that's the hope anyway. So, but I think as long as, we keep those guiding principles in mind, I'm happy to take on any request and keep the service geared toward the patient and helping them in their situations. Because when I had to go for my partial hysterectomy, for example, I had to have that within 2 hours.
Oh, wow.
And
good Lord,
I had no idea. And my mother, she just said, you don't do this to her. You give her some drugs. I went into shock. So when you're in that state, you don't think clearly.
You can't
at all.
respond. You can't.
You cannot respond.
Good
and
Lord.
You're just trying to absorb what they're trying to tell you. And you really don't think clearly. So if all I had to do was pull out a card at the time, instead of try to sit and answer these questions, it would have changed everything.
Yeah.
You can find us on Twitter at The Connectors, on Facebook at The Connectors Podcast, and on LinkedIn at The Connectors Podcast as well. Or reach out by email at theconnectorspodcast@gmail.com.
Earlier you said it's like you're buying time. And I was thinking, yes, because you're so pressured in the medical industry. Like, I think the average doctor spends something like 3 minutes with a patient or something like that. So if you can buy a minute here and a minute there, it means that you can aim to get more care, or you can just tell more about your situation. But then, like what you were just saying about that, it's about your situation being there with a partial hysterectomy and just going through the shock. It not only buys time, but it buys you an emotional cushion or some safe space where you can just be like, okay, here's the info. I need to talk about this, or I need to go for a walk, or whatever.
Yeah, it does. And it's really interesting because they ask for this information at the registration desk. Then they ask it again when you are brought into the first visit with the doctor. The nurse then asks you the same questions. Then when the doctor comes in, they're asking you the same questions. And if you're in a teaching hospital, they will sometimes send in a few interns to ask the same questions. And because they're learning, and I understand that, they have to learn. And I'm happy to help that situation and help them learn through it. But as a patient, I tell you, when you're in pain, you just don't you have this on your file? Please just read the screen, do something. I'm not in the right mood.
You're low energy, you're not feeling great, maybe you're actually in pain at that moment. Like, you do not want to answer that stuff.
Exactly. So you just, I've had that situation, believe it or not. I've had 2 to 3 interns come in asking the same series of questions because they were trying to learn. And because the situation was so strange, teratoma is not something, everyone gets. They were all curious. And at the time it was the largest, I believe, which was bizarre, and that I never had any other symptoms other than I couldn't breathe, which is major, but there was no pain. There was no pain. I would be running, I'd be doing step aerobics, I'd be doing, biking, all sorts of exercise, and just a difficult time getting my breath. But never, I just thought, okay, I'm still out of shape. Why am I not getting any stronger here? This is crazy.
That was the main symptom that you had, was just the,
Yeah.
like, not being able to catch your breath. Wow.
Yeah. The final
Wow.
straw was not being able to climb a set of stairs. So think of it now. Think of the beauty of this now, to be able to take all of the trauma and turn it into something that can help so many other people with such a simple solution. I know it's simple, but it's designed to stay simple. It's designed to be easy for people. And
it's simple, but it slips between two very friction-filled areas, and it just smooths them over.
Impactful.
That's the wonderful thing about, it's super impactful. Super. Yeah.
And I love just this story of yours, Michele, just because I feel like when you share it, I feel it's from your heart. You're a very heart-centered person, and the way that you're creating it is really about the people and a focus on what's best for them and their privacy, and to cover all their concerns. And to me, that seems like you're a very connected person to humanity and to yourself. I'd like to know, what is connection to you?
Connection, in this world, this day and age, it's obviously getting away from us a little bit with the online social media platforms and AI. Connection to me is still the human connection. I'm old school. I like to meet the people I work with. I like to talk to the customers, the members. I'm interested in knowing what they think and how they feel I can improve the service on their behalf. I think that's important because I can't read minds. But anyone I've been engaged with this service, I've asked, I need to meet you. I want to meet you. I went and met the manufacturer and then the team, toured the plant, the facilities. That's important to me, and I know it's old school and people would just maybe leave that piece out. I can't. I need to see who I'm working with. I need to clearly understand what they do, how they do it, how they protect it, and to share the importance of what I am trying to do and why it's so important. And everyone I've enlisted, from the manufacturer to the web developer and other individuals, they are just as passionate about this as I am. They know how important this work is, and they're not taking it lightly either. They're all taking it very seriously, and I'm thrilled about that. It means the world. It really does, because I don't have to do this. I want to do this.
And I would never leave that.
I'd never leave that.
Yeah, I'd never leave that bit of information out. I think human, as you know about us, our human connection to us is extremely important. So
it is. It is. And everyone's amazing as well. We had, it's been great meeting them. They're amazing people. So, but I am old school. I do like to meet everyone I work with. I think that's important.
Yeah. There's a poet, John Donne, and he said, like 400 years ago, no man is an island, each is a part of the main. And like every one of us is part of the mainland. And we're all connected together, embedded in some way, whether we think it or not, whether we like it or not. We're all a part of this beautiful mass of humanity. Or as I see, like a huge global Mother Nature Gaia thing going on. But yeah,
it's true. And I really do love the name of your podcast. I think it says it all. And that human connection can never go away. We can have social media, we can have all of these great tools, but the human connection, we're here, we're social creatures. And the people that do come into your orbit, there's a reason for that. There's a reason they come in. There's a reason they're meant to teach us something, help us, guide us, mentor us, show us something that adds value or meaning or something to teach us why we're here and how we can improve ourselves as well, right? So
that's why we're so happy you're here, and we want to share your message, because I think it's an extremely valuable message and tool that people could be using, should be using. Is there anything else you would want people to know about yourself, about the service?
I just think that as long as people know that it's coming from a real place, and to live this work as well is a constant reminder of what I've gone through. So it's not always easy to share. Yeah. It's very vulnerable, but it's really important work to me as well. It's just important. And I think you don't realize how important your health is until you're put in that situation. People might think, well, I don't need that. It's not, I'm healthy. I don't need it. I was doing really well too, until I wasn't. Now I'm great again, but it's like I kept getting knocked around until it was like, you know, are you getting the message yet? Like, do I have to make you sick again to realize that this is what you need to do in life? So, you know, I'm really glad that the idea finally popped up, because I just don't want to get sick again, you know, but yeah, so it was easy to create in my mind because of all of my own personal experiences. It did not take me long. The prototype I had designed in 15 minutes. But taking a very simple idea and going through all the regulation and compliance and, you know, the technology and bringing it to market, not an easy task by any stretch. There's been a ton of challenges. There's been a lot of difficult days in doing this, for sure. But I have built an extremely strong foundation. I'm very proud of this service. I'm very proud of what it's able to do for patients. And if there is any way I can help the healthcare sector, you know, I hope this does that for them. Yeah. You know, because they do incredible work. I could never do their job. And going into a hospital, it's not my favorite place to be, I'll tell you right now.
You've done it enough.
That's kind of the last place I ever ironically go for. It's a bizarre place to be right now to actually do this work with that kind of a background. But you know, it's really great for businesses too. You know, if they're looking for something very unique and to show that they do care about their employees and their health and well-being, right? This is a great offer for employees and their benefits, or, you know, for retaining employees, for enticing new employees, you know, attracting
as
new
part of the
companies.
onboarding process.
Absolutely. I've had small businesses contact me saying, this is amazing. This is great. You know, they want it for their employees. And I think that that's a really unique offering that can not only show that their employees that they care, but it still gives those employees full control.
Absolutely. I'd love that if my work provided that, for sure. Can you also add like your vaccines and things like that on there too? Yeah. So all that.
Yeah. You know, I was speaking with a girl today. I said, so, you know, she wanted to see it. And I scanned my card, showed her my profile, and she says, oh, you've got your tetanus shot on there. I said, yes. I said, I don't remember when I got my last tetanus shot. Do you? And she's like, I have no idea.
I was a kid in school. They lined me up and
we got the boosters, right? I mean, that's what you didn't know. So, but it's important to know when you got your last tetanus shot, you know, and when
I do actually remember. I had mine 4 years ago.
Okay.
Okay.
No, I was doing box jumps on rocks by the beach near my parents' place. So like jumping these big rocks, and then I ended up slipping and scraping down the front of my shin. And because the rock was dirty, and I guess I know it's kind of a gross story, but when you scrape close to the bone, you're supposed to get a tetanus shot, because bacteria gets into your bloodstream much faster if it's like along the bone like that. So I had to get my dad to come pick me up. He laughed at me. He says, "You're not 20. Why are you doing that?"
Wow. What an appropriate reaction.
So I actually do remember when I got my last.
Good for you, though.
Same.
You've got to have fun.
Does not sound fun.
You have to do it, because are you going to do that when you're 80 or 90? Maybe
I don't
not.
know if it was fun. I think it was just, it was a little bit of masochism, I guess. But yeah.
Oh my God. Oh, that's cute. No, I just think that there are just so many scenarios where this can help, and our healthcare system here in Canada is changing a lot as well. So I think that, having that little bit of, emergency preparedness in your back pocket and not, I'm single. So when I go out with my friends, they know where my card is. If I happen to go down, they're not guessing, what my blood type is or what I'm allergic to or who to call. They know exactly what's going on. So there's a lot of freedom in that, right?
Yeah,
you don't have to worry that,
absolutely.
Yeah.
And something I just wanted to highlight that you mentioned before as well, just because it ties into, I think, our show and, the ethos of what we speak about here. But just based on I know sometimes it's really hard to go through trauma, and we've all been through a variety of our own kinds. And but sometimes when you go through those things, it's what brings you to that next place and closer to that thing you feel you should be doing, or that thing that you want to offer the world. And through your experience, that's what it brought you to. And I think it's just a good message for everybody to think about, when you have things going on in your life, how can you reconnect with yourself and try to really find that thing of like, this taught me something. Now, what am I going to use it for? Am I going to use it for something good? Am I going to use it, to help others? Am I going to use it to self-loathe, or and just continue down that way? But, I just love when I hear these stories of something that was created out of the experience that you had.
I feel like that's becoming a bit of a theme with our guests, to be honest, like this crux moment where they connected with something that was deep inside that they'd always repressed or pushed off or not taken seriously, and then that sparked something. It's a pattern. But yeah, Michele, thank you so much for joining us today.
Thank you so much for having me.
Yeah. Remind us again, how can our listeners get hold of you? What is the website?
Yeah, so they can go to my911.ca. I'm on LinkedIn. I'm on Twitter, although I'm not sure if that name is going to stay relevant with the recent change of the logo.
Yeah,
exactly. Instagram, Facebook, and I just started a YouTube channel. So,
Awesome.
Yeah, so it's growing, and people can reach out anytime. They can email me at info@my911.ca. For more information, I'd love to speak with anyone if they want to give me a shout. Just, email me and say they'd like to connect, and I'd be happy to connect with them and help them, learn more. I know the students are coming up for registration, so I think it's a great opportunity for families to, provide this for their students who might be, going to school out of town or even across the pond, right?
We'll make sure that all those ways to connect with you are in our show notes. And I just really want to thank you so much for sharing your story, because I know it's hard to probably relive that over and over. And your message is such an important one. And I think you're creating an amazing tool, and we're going to see a lot of you, I think, really soon.
Well, it is my pleasure. And I thank you again, both of you, for having me on the show. I really do appreciate it.
If you've got a story inside of you, consider pitching it to us, the Connectors. Get in touch with us on any of our social media platforms, and either Joe or myself, Quinton, will get back to you. So come join us on the show and let's connect.